This week, London Real meets UFC fighter Dan Hardy.
I'm not an athlete, I'm a fighter that's trying to be a martial artist.
His wins and his losses.
That's it, I'm done. I'm not enjoying it anymore. This is not fun for me anymore. I'm not getting anything out of it, I'm just getting damaged.
He talks the spirit world.
The thing is, like, ayahuasca doesn't necessarily do anything to change the person. It just helps the person understand who they are.
And introduces the Wolf Heart.
They want to feed the wires into my heart so they can measure the second heartbeat. They can then burn it.
London Real presents Dan Hardy, Uncut.
Every subject's on the table, so feel free to ask away.
We were down in Peru, and I remember you saw like a spirit animal, and it was almost like a premonition because it was a wolf.
Kind of weird, right?
Yeah,
Yeah.
It's kind of weird.
And there's something else weird as well,
Okay.
is about my nickname. My nickname's The Outlaw, which we were talking about, and it came completely organically to me. I didn't really pick it for any other reason other than it was kind of fitting at the time. I was training with a guy who I wasn't really connecting with very well, so I left, and he called all my training partners to tell them they couldn't train with me. So I'd been outlawed, and that's where it came from. That's the obviously the Robin Hood thing ties in. But if you
Dan's from Nottingham, which is where Robin Hood's from, in case anyone doesn't know.
And my Outlaw Army shirts, one of the Outlaw Army shirts, it says Outlaw Army across the front. It's got a big fist on the back. Across the bottom, it has a scroll, and it says, and I usually get it wrong, it's Caput Gerat Lupinum, it's Latin, and that's the law for outlaw. Let his be the head of a wolf.
Yeah.
That's what outlaw means. It's so outlaws were called wolf heads.
Huh.
So, and I didn't know this until I was reading it was a Robin Hood comic book. And it was like right inside, and the first thing they said, "Let his be the head of a wolf." So
It's a weird coincidence. So you fight in California, and they hook an EKG up to you, which is probably the only state that does that. Perhaps.
Yeah, I think maybe Florida as well.
And that was the first time you fought in California.
Yeah.
And all of a sudden, they give you some interesting news.
I'm abnormal.
Big surprise.
Big surprise. Yeah.
So I guess they call it Wolff-Parkinson-White syndrome, and it's, correct me if I'm wrong, an abnormal electrical pathway in the heart. And while instances of fatality are extraordinarily low, they're concerned. Is that what it is? So it's kind of an extra heartbeat in there, or just some,
yeah,
okay.
yeah, and it's quite common. I was surprised how common it was. About 1 in every 1,000 people have it in some capacity, and a lot of people are born with it. And the extra cells die off in the first couple of years of birth, after birth. Sorry. But most people don't ever find out about it because they don't have any symptoms. And I'm in this boat. I've never had symptoms. Dizziness, palpitations, panic attacks. There's all kinds of stuff that could potentially happen because of it. But a lot of people live their whole life without having any idea. And that's not called Wolff-Parkinson-White syndrome. That's called Wolff-Parkinson-White pattern. And that's what I have.
Okay.
But the difference is, and I don't know whether this is partly to do with the fact that I've been an athlete for so long, and I've always been in an active state. But I have my regular heartbeat, which is very strong, and I'm always in fairly good shape. So when I went and did the test, my resting heart rate was 42, and it maxed out at 191. But usually in these circumstances, the second heartbeat, the second bunch of cells is quite sporadic and quite weak, but mine's quite powerful. So that went up to 183. That's where it maxed out. So I effectively kind of have two heartbeats that beat at the same time.
At high rates?
Yes.
Okay.
And their concern is that the way that the doctor described it to me is imagine you're 12 minutes into the fight, and your adrenaline's up, and all of a sudden the current in your heart loops back on itself and causes cardiac arrest.
You're probably sick of these analogies.
Yeah. I was like, oh, okay, right. So how likely is that? Oh, well, no, it's not likely. So can you claim me to fight? Well, no, we're going to have to go into your heart and have a look. And it was just this weird kind of like, no one gave me a good explanation of why I couldn't fight, other than the fact that I'm slightly more of a liability now than I was before.
And is your heart rate up around those levels when you're fighting 5 rounds with GSP?
I would think so. Not consistently.
Right, you couldn't be
because I
consistent.
couldn't keep it up. But I would certainly think 170 range, 170,
Right.
175.
It's just interesting because you've been training at the top level of
Yeah.
athleticism, which is mixed martial arts, for 13 years or 15 years more, and you've never had any issues.
Never had any symptoms or anything. And the other issue that I'm having is that everybody that I speak to about it that's had the procedure has had it because they needed it.
Can you describe this procedure?
It's called a catheter ablation, and they feed whether it's a wire or something up your femoral artery and then one into your neck. But they've said to me that it's not that they can treat me; they want to study it because it's kind of abnormal because of how strong it is and because of the job that I do. So they don't know whether they can fix it. They want to feed the wires into my heart so they can measure the second heartbeat. And if it's strong, and B, if it's in a safe place, they can then burn it.
Burn the cells out.
Yeah, burn the cells. But if it's not very strong, which we already know that it is, so they don't really need to give me that option, then they can clear me to fight. And if it's in a place that's not safe, if it's too close to my regular heartbeat, they can't touch it anyway, because then that would just shut my heart down and I would have to have a pacemaker. But the issue is that obviously the easiest option for everybody is just for me to go and have it done.
Which is what you're getting
Because
pushed for.
that's what everybody wants. So the fans all want me to just go and get it done. I get tweets constantly. My 6-year-old's just had this done. You should just go and get it done and get on with it. But yeah, but your 6-year-old needed it done, and I don't. So the only reason I would have it done is if I really want to fight a few more times.
Yeah. So that's the question.
Yeah.
Do you want to get this done and fight, or do you just want to go and live your life?
Well, the thing is, I would love to fight again. That's the problem. But not to the point where I would go through something like that I don't feel I need to do. It just doesn't seem right to me.
It's not an option, that procedure.
No, I'm comfortable. I'm healthy. I've never had a symptom. So then, what if somebody goes in and starts messing about with it and it causes more issues? I've heard of people that have had ablations that have had to go back 3 or 4 times to have more work done. I don't want this to be a part of my life, and because it's not affecting my life right now, other than my career, I don't really see a point. And I don't hang that much value on my career, to be honest.
Right. That's my question. Take us back 7 years, and you get the same diagnosis, and UFC says, look, you want to keep fighting, you got to have the surgery. Would the Dan Hardy of 7 years ago had a different decision?
You wanted to be champ then, so
yeah. I would have. No, you're right. You're right. I would have made a different decision, I'm sure. And it would have taken somebody like my mum or my dad to talk me out of it.
Right. The sensible side.
Yeah.
And how much do you think, maybe this is a strange question, but how much do you think that the psychedelics have a part in expanding your mind and showing you that what does any of this matter to a certain extent, as far as the ultimate thing isn't your fighting career, and there's other things in your life?
Yeah, I mean, partly because of the losing streak, I am aware of my other options because I've already explored them.
Right.
And partly because of the ayahuasca and, because of the psychedelic experiences in general, I have an acceptance now of just what is, Sometimes it just is what is, and just accept it and keep moving.
Very Buddhist.
Yeah, I guess. Yeah. But I mean, my mum said to me when I called her up and I kind of explained, she said, well, you've been talking about retiring in 12 months, but we both know that it would take something like this to stop you fighting. And the thing is, and it's going to sound strange, but it's my comfort zone. Like training camp and fighting is my comfort zone. I can do it every day, all day, and it's easy because I know what to do.
And you're good at it, so you get that positive feedback.
Yeah. So the idea of actually like saying, I can carry on doing this if I choose to, but I'm done with it now, I'm going to go and do something entirely different. There's a lot of anxiety that comes with that. So I think it might have taken something like this to pull me out of the situation anyway.
So have you made any decisions?
University starts in September.
Yeah, not this year.
LSE has a great philosophy program.
Is that right?
I looked into it. Yeah.
I might have been punched too many times in the head to get accepted, though. That's the problem. I have so many options on the table for me right now, and I'm kind of in a bit of limbo with the UFC because obviously they're very keen to keep me on board, and they want me to carry on fighting, which I do and the fans do, but but I have made my decision about this, and unless there's some kind of flexibility on their side, it is what it is.
But why could you not fight in a jurisdiction that's not going to test your EKG?
Because it's not about them. It's not about not passing the test. It's about the liability of letting me fight.
Okay.
Yeah.
The problem is, I mean, they could let me fight in London, and you know, you can wear shoes in London to fight, and no one cares. You know what I mean? It's ridiculous. But we have no athletic commission, so you can do what you like effectively. So the UFC is only answerable to themselves. But then, in the very, very highly unlikely circumstance that something does happen,
Their insurance fails.
Exactly, and they already knew about it. That's the problem. Now they're aware of it.
Yeah.
And I'll be honest. I don't want to put that on. I don't want to put that on the sport. I wouldn't want that for the sport of the UFC, because the MMA is still very fragile.
Yeah.
You know, and a recognizable athlete fatality in the sport would do too much damage. So I wouldn't want that. And if I felt like I was a liability, I would be like, all right.
If you like alternative history, which is what I do, then expect everything that you say to be turned over forensically, very, very closely, by large numbers of hostile academics.